due on shortlisting back in November, and still we wait.
Let's just swap over to camera,
Latest
guys.
reports say that this announcement may take place in a few weeks' time. But meanwhile, the NHS and the QA continue to be in a poor state, with now over 400 pieces of wood and metal holding up the roof, and the condition can only get worse. It's also estimated that 3 billion is needed to refurbish the hospitals in order to increase the number of beds available. Since 2010, prior to the pandemic, the capacity of our hospitals has decreased by nearly 15,000. Since the pandemic, this has been reduced by
Stop communism!
Unison believes that this government needs to invest in a fully publicly owned NHS and guarantee free healthcare for future generations. The Health and Care Bill does nothing to address the increasing amount of services being outsourced to the private sector. For more than 30 years, successive governments have brought in legislation that have looked to bring in privatisation more and more to the NHS, often through the back door. From the private finance initiatives introduced in 1992, then the creation of an internal market and competition has led to privatisation of public services and the formation of an NHS Foundation Trust, to name but three. In 2019-20, the NHS spent £9.2 billion on services provided by the independent sector. If spending on primary care services, including GPs and pharmacies, optical and dental services is included, some have estimated that approximately 25% of NHS spending goes on the private sector. Private companies who invest in our NHS have an obligation to make a profit and to give a dividend to its shareholders. Money which could, indeed should be spent on essential services is instead being paid to investors, and in many cases to companies whose sole aim is to make money for their own shareholders. Billions of pounds have been paid out in dividends that should have been used to build hospitals, provide better services, as well as pay more for the much needed NHS staff. Unison supports fair pay for the NHS staff. Last autumn, the government awarded NHS staff a 3% pay rise. At the time, the Health Secretary, who was earning more an hour than the majority of NHS staff earn in a month, told us that this was a pay rise in recognition of their extraordinary efforts. The rise at the time was only slightly higher than the rate of inflation at that time. Inflation now is above 5%, and with the increase in national insurance coming in April, it will rise to 7% or more. This heralded pay rise has become a real terms pay cut, with the increased cost of living, which will mean thousands of NHS staff will struggle to make ends meet. Since the first COVID case was confirmed in the UK, close to 1 million people with COVID have been treated in hospitals across the country. Several hundred NHS staff have died from COVID. Many of that number as a result of inadequate or insufficient PPE. Tens of thousands have been off sick with COVID and still suffering the effects of long COVID. Within the NHS, there are around 93,000 vacancies in our hospitals. Within the NHS, which amounts to almost 10% of our workforce. Without a pay increase that at least matches inflation, more staff will take the decision to leave the NHS. The government has this week recommended a rise of up to 3% for nurses and other staff later this year. They say that anything more may mean cutting patient services, including surgeries. This is the government once again trying to present it as an either-or situation, pitching nurses against patients. This is just completely and totally unacceptable. And waiting lists in our hospitals stand at nearly 6 million. Back in 2010, this was 2.5 million, which went to 4.5 million before the pandemic. The government recently introduced plans to tackle the problem, but say that figure could almost double before it starts to go down. Massive investment is needed now in order to solve the problem, but this government seems to have little desire or any inclination to take the steps that are needed to save our NHS. We call upon the government to provide the emergency funding needed for new hospitals, for improved services, and for a decent pay rise for staff. Thank you.
Thank you, Gordon. It's vital that we remember this is a government that is happy to fill the pockets of its private sector mates with publicly funded money, yet unwilling to give nurses and healthcare staff the pay rise that they deserve. They've been working under incredibly difficult circumstances, as Gordon said, over a decade, 12 years of cuts to funding. And yet they're still expected to shoulder the burden of an NHS which has been deliberately set up to fail so that the government can justify privatising it. These are services that many of us rely on, that we take for granted. But make no mistake, we will be in the situation where you will go to access these services only to be told they are either no longer there for you or you have to pay. We cannot accept a situation where the American-style healthcare is brought over to the UK and we have to pay for it. A young lad just walked past and said, "Down with communism." Well, the NHS is the last thing that communism is. It's something that we all contribute to, and it's something that all of us have used at some point or another. And even if you were a private sector patient, if your private sector operation went wrong, you would be rushed to the publicly funded NHS A&E. And this is why it's so vital that we work together to overturn the Health and Care Bill. This t-shirt is nearly 10 years old. I used it to lobby I wore it when we lobbied Henry Bellingham in 2012-14 over Andrew Lansley's NHS Health and Social Care Bill, which brought in even more privatisation. Well, this most recent edition is going to make it even worse. So I urge you, take one of our postcards and send it to your MP, whose office can be found above Britain's estate agents on the Tuesday marketplace. Drop them off there and tell him you want him to vote against the Health and Social Care Bill. Thank you. Does anyone else want to say? John, do you want to say something?
Don't vote Tory. Me too.
Hello everyone, people of King's Lynn, we're here today for our campaign to save our local hospital, which is being held up with over 400 roof props. We're still waiting for a decision to be made whether we get a new hospital. So I urge all of you to get in touch with James Wild, your Tory MP, and demand that we have a new hospital, because he's delayed it. So next time you're at the ballot box, remember these decisions that are being made for our local community. Don't vote Tory, that would help. And also put the pressure on our local MP and join our campaign. Thank you very much.
B-roll.
Don't help me. Should I work? There's no
Thank you.